Sarah, I've read that 1 in 10 people are depressed. If there are that many people depressed, are they going for help?
No, I would say that some of them are, but there's a large group that are not. A lot of people are scared to ask for help. They worry if they go talk to their doctor about it that they're going to be labeled as crazy. They don't like that information written down, or they're not used to talking to their medical doctor about feelings. They're used to talking about physical issues. And it's scary to ask for help. There's a big stigma out there about mental health, and we're hoping that that goes away soon, but it certainly is a barrier for people.
What about signs and symptoms? How do they know they're depressed, or a friend or a family member? How do you recognize it?
Sure. I would say that, there are some common symptoms that we do see. Some of those would include a sad mood, just feeling down in the dumps for a period of time, maybe sleeping a lot or sleeping a lot less, or your appetite is a lot more or less, just basically changes in your normal functioning. Sometimes people will stop doing things they used to really enjoy. Sometimes people just are irritable and kind of grumpy. Some people have been depressed for so long that they really don't know that they're depressed. They don't know that they can feel better. They just kind of are used to it.
What are the first steps if people believe they could be depressed? What should they do?
Well, one of the things that I usually recommend to people is the first step would be to contact your primary care physician to rule out any medical causes of depression. There are some conditions that can cause depressive symptoms, for example, like diabetes or thyroid issues. And once you can take the steps to make sure it's not a medical issue, you can talk to your doctor to come up with a plan of what to do next, whether that's go see a talk therapist or see a psychiatrist or talk about medication. There are also community mental health centers around where you can access a therapist that way. I know people worry about cost and all of that, and most community mental health centers, they'll either take insurance or based on income if you don't have insurance.
Okay. You touched a little bit on some of the treatments. What is kind of the suggested treatment for depression now?
Sure. Well, there are a couple of things that we suggest depending on what's going on with somebody. Sometimes people will just do medication and that's okay as long as there's not other things going on, but most of the time when people get depressed, there are other issues happening. Maybe there's a life stressor, maybe a divorce or a death in the family or something of that nature, in which case we recommend the combination of talk therapy and medication. And the best course of action is to talk to somebody about it to come up with a good plan. But what research suggests is the most effective course of action is a combination of therapy and medication.
Okay. Can people get better on their own? I think a lot of people try to. Is that a successful way to deal with it?
Well, sure, for some people, but I would say that can sort of have the opposite effect sometimes. People who get better on their own, usually that happens pretty quick. For people who try to get better on their own and they don't, what ends up happening is then they feel badly about not being able to get better on their own, so they sort of turn into this bully where they beat themselves up for not getting better, which makes people feel more depressed, in which case it would be very beneficial to reach out to get help at that point.
Okay. So what do you kind of say some of the first steps are? You think you might be depressed, you recognize some of these symptoms, you're not sure. Where do you go first? Do you go to a psychologist? Do you go to your primary care physician? What do you recommend?
Well, I would say if you're not already connected to mental health, you can certainly ask your primary care physician what their thoughts are. You can look up more information online, which is always a good thing to do, but it's also good to ask a medical professional, whether it's your medical care provider or it is a psychologist or a mental health provider.
How would someone know if they're severely depressed? What are the symptoms of being really, profound depression?
Sure, that's an interesting question because sometimes when people are severely depressed, they don't always recognize that. They feel so bad that they don't even think much about what's happening in their life. When somebody gets severely depressed, there's a lot of things that can happen. People can feel so bad they don't get out of bed, they don't want to shower, they don't want to eat. People sometimes have thoughts about hurting themselves when they feel severely depressed. And I would say if you're at that point in your life, or someone you love is at that point in their life, it is imperative to get help. And people do not get better by themselves from severe depression.
Okay. We also talk a lot about anxiety, and there's a lot written about that. And I've read that, if you're depressed, that half of the people that are depressed also have anxiety along with it. What is anxiety? Is it just generally feeling anxious, worried, or is it worse than that? What is really clinical anxiety?
Well, sure. A lot of times what I see, people will come in and tell me their nerves are bad, or they just worry all the time. And for people with anxiety, they find themselves worrying about a lot of things that they can't control. Everybody worries sometimes, that's really common, but when it gets to the point where you're worrying all the time and you can't control the worry, that's when it becomes a problem. Anxiety can feel like a physical thing for people. People get tense, they have trouble breathing sometimes. Sometimes people have panic attacks, which they think they're dying and they're having a heart attack. So certainly it's just as important to get help for anxiety as it is for depression, because there are some skills that you can learn to manage anxiety. Some things like deep breathing or, whatever works for you.
Okay. So is there any, finally, when you go and get help and you're feeling better, I think sometimes I hear that people are afraid of getting worse and or getting depressed again, or their anxiety comes back. How do you stop this cycle?
Sure.
Does it stop for people, and how do people get help to do that?
Sure, it certainly can stop. Typically, what we recommend is once people are feeling better, that doesn't mean stop everything right away. That can mean like spacing things out, gradually coming off of medication. But what really works is once you've learned about your own depression or anxiety, you can learn what are the signs and symptoms that mean maybe another episode is coming on. And if you know the signs and symptoms, then you can do something about it early on. That doesn't necessarily mean coming back in for therapy. It just means getting those tools back out that worked for you before, to intervene early.
Okay. So from what you've said, it just sounds like maybe the first step is making that phone call to maybe your primary care doctor and getting checked medically, and go from there.
Absolutely.
Okay. Well, I appreciate your time. Thank you so much.
Thank you.